Hello, how are you doing today? My name is Norhan.
Hello, my name is Bob. I'm good. How are you?
I'm good, thanks for asking. Welcome to Norhan Counseling. Here we do cognitive behavioral therapy, which bases itself on how we think, feel, and interact. This type of therapy recognizes how our thoughts can determine our behavior and feelings. Throughout our sessions, I'll use this technique to help you become aware of your thoughts and situations that can cause negative thinking and distress. We'll also be going over techniques that can help shift your thinking and behaviors to reduce the distress you feel. Overall, we'll identify the difference between thoughts and reality and take a look at the influence our thoughts have on us. At the end of the session, I'll give you a homework to assist you in challenging your beliefs, and this will contribute to the change process and recovery. Are you okay with this?
Yes, I'm okay with this.
Great. Before you start, I'm going to go over some limits to confidentiality with you. Is that okay?
Yes, that's okay.
Great. So everything we discuss here today is confidential, and I can only disclose information with your consent unless it's one of the following situations. Then I'm obligated to disclose information without consent. So the situations where I would need to disclose information are if I believe there are reasonable grounds that disclosing information is necessary to reduce or eliminate significant imminent risk of seriously bodily harm to yourself or anyone else. If I have reasonable grounds to suspect that a child is in need of protection due to neglect, physical harm, or sexual abuse by a person having charge of the child, where it's necessary for particular legal proceedings to facilitate an investigation or inspection if authorized by warrant or provincial or federal law, for the purpose of contacting a friend, relative, or substitute decision maker if you're injured, ill, or injured and unable to give consent. And lastly, to a college for the purpose of administration or enforcement of the Regulated Health Professions Act of 1991, which is if a complaint has been made against me or my practice needs to be assessed, or if you're a regulated health professional and I have reasonable grounds to believe that you have abused a patient. Do you agree with this?
Yes, I agree.
Great. So what brings you in today?
I've recently been charged with drunk driving. My dad was an alcoholic, and I vowed never to follow those footsteps. I drink heavily every night, and I'm concerned I don't have a social life. I used to play hockey with friends, but not anymore. I also used to volunteer weekly, but I gave that up a few years ago. I feel depressed. My job, family life, and life in general is miserable. Sometimes I think of suicide, but I don't go through with it because I don't want to put my family through this.
If I'm hearing you correctly, your dad was an alcoholic and you vowed not to follow those footsteps, but you drink heavily every night and have been recently charged with drunk driving. You're also concerned that you don't have a social life and quit hockey and volunteering. You feel depressed and see everything around you miserably, and you've thought of suicide but haven't acted on it because of the pain it would put your family through.
That's correct.
Okay, let's make the focus of this session on the comments you made about being concerned about not having a social life. How does this sound to you as the start of our sessions?
Yes, that's good with me.
Great. So regarding your concern about not having a social life, what triggers this thought?
This thought gets triggered when I see my employees make plans to go out together and I'm not included, or when my employees tell me about their weekend and the activities they did with their friends, or when my kids go out with their friends or participate in sports and come home telling me all the fun they've had, people they've seen, stories about their close friends, things like that. I'm not able to relate because I never go out and don't have stories to tell. I go to work, then come home and drink. On the weekends, I don't go out either. I don't have a big social group to reach out to. I spend most of my time at home, and my life gets repetitive with my family and work every day.
I see. That can be very frustrating hearing people's stories about their plans when you're not included, or hearing about others' experiences when you can't share the same experience.
Yeah.
Are there other negative thoughts you have related to this trigger?
Yeah, I think that I have no friends. No one wants to hang out with me. I have poor social skills. I'm boring. I'm annoying.
And how do those negative thoughts contribute to your behaviors and feelings?
This makes me go into my depressive mode. I get really sad and upset. My behaviors change and I become isolated. I want to keep to myself. I talk less. I'm less interested in doing activities. I start to drink more to get away from my sadness and emptiness. I lash out when my family tries to talk to me when I'm in my alone time. I want to be alone. I don't want people to see me. I cry sometimes or hide.
If I'm hearing you correctly, you feel sad, upset, and empty, and this causes you to drink, isolate yourself, talk less, lash out, cry, or hide.
Yes, that's right.
On a scale of 1 to 10, how would you rate your feelings of sadness, emptiness, and upset, and why?
For sadness, I would currently rate myself a 9, and this is because it's the main reason for my thoughts of suicide, which I've been feeling a lot lately. For my emptiness, I'd rate myself an 8, and it's because it's the main reason for my drinking, and I drink a lot. For being upset, I think I would rate myself a 6 for that one because it comes in waves.
I see. So, what is happening is that you're having negative thoughts and they're determining your feelings and behavior. Sometimes our unrealistic and negative thoughts get in the way of our lives and can cause distress. I see that you get triggered by others participating in social events, and it makes you think of your social life, and you become concerned that you don't have a social life and think that no one wants to spend time with you or you're boring, and that makes you feel sad and you turn to drinking alcohol. We need to work on your awareness of your thoughts on certain situations and ensure they're realistic and not negative to cause you distress. How does this sound?
Yeah, that makes sense. It's not really realistic for me to have all those thoughts over other people telling me about their social lives. I might be too harsh on myself at times.
Great, and that's okay. We can work on that together.
Thanks, I appreciate the help. Where do we start?
I will introduce you to self-talk. This refers to conversations you have in your mind. This can include negative and positive thoughts. Regarding negative thoughts, we'll go over some techniques you can try to control your self-talk. The first technique is called thought stopping. Thought stopping happens when you continuously stop negative thoughts in your head. You can try this by catching yourself thinking negatively and interrupt the flow of consciousness and say, "Stop this thought." This technique starts with you being aware of the negative thoughts and then putting a trigger to stop these thoughts. And the trigger can be a word or physical action. While doing this technique, you'll be able to monitor your habit and decide to change the negative self-talk to positive self-talk. Does this make sense?
Yes, it does.
Great. Can you brainstorm some phrases or actions you may take to stop a thought?
I can say stop right now, go away, stop, or do actions like jumping jacks, opening and clenching my fists, counting to 10, or clapping my hands together to snap out of it.
Those are really good ideas. What are your thoughts on this first technique so far, now that you've identified some phrases and actions you can try to stop a thought?
I think it's a good idea. I like it so far. It seems interesting and fun to try out. I'm excited to try it out.
That's great to hear. I'm glad you're liking the first technique and willing to try it out. We can add it to our homework at the end of the session. Shall we move on to the second technique?
Yes.
Great. The second technique is changing negative thoughts to positive thoughts. To do this, you can couple your negative thoughts with positive thoughts that provide redirection or provide support, repeat positive self-enhancing statements, or add relaxation techniques like breathing exercises. How about we practice changing negative thoughts to positive thoughts?
Yeah, that doesn't sound too bad. We can practice it.
Okay. Going back to our topic of today, your concern about not having a social life. Can you list some positive thoughts that can replace the negative ones you mentioned earlier?
I thought that I have no friends. A positive thought to replace this is that I do have friends. I have 3 close friends that I gained from hockey and I still talk to. Although I don't see them as much as I want to, I still talk to them a lot. Another thought I had is that no one wants to hang out with me. And a positive thought to replace this is that no one has said that to me and no one has ever avoided hanging out with me. Another thought I had is that I'm boring, and a positive thought to replace this one is that I am an active person and I like to do activities and I'm actually outgoing and I'm open to everything.
That's a great start. You're a pro at this. I'm proud of you. You definitely have the hang of this technique. Have these new thoughts changed anything in your behavior or emotions?
Thank you. And actually, I do feel much better than before. I don't feel sad anymore. I feel relieved. I feel like something has been taken off my chest, and I think it's all the sadness I was feeling before.
That's good that you're starting to feel better. With practice, this technique will come easy to you and you'll be able to apply it in many situations to address triggers and shift your negative thinking to positive thinking to control your emotions and behaviors. Do you have any questions so far on the techniques?
Yeah, you mentioned breathing relaxation techniques. Can you give me examples on those?
Yeah, of course. There's a deep breathing technique that you can use when tense. What you do in this technique is you take a deep breath, expanding your abdomen fully. Hold the breath for a couple seconds, then let it out. And while you're exhaling, you would relax your shoulders and jaw and think calm thoughts. Another technique is called ideal relaxation. This is where you picture a place where you can be at peace, close your eyes and visualize it, and using your senses, hear the sounds, see the colors, and feel yourself in comfy clothes. Whenever you need to relax, you can come back to the spot and take a mini vacation. Another technique is called 4-7-8 breathing. This is where you exhale and count to 8, inhale and count to 4, and then hold your breath and count to 7. You keep repeating this cycle for 4 to 5 breath cycles. How about we try one of these techniques right now to get you familiar with them?
Yes, I'd like that. Can we try the vacation one?
Yeah, of course. I'll set up a timer for 1 minute where you can visit your mini vacation spot. And then after that minute is up, we'll discuss it.
Okay, sounds good.
Okay, I'll be starting the timer in a couple seconds. Make sure you're comfortable and ready to relax. Here we go. I'll let you know when the timer is done. I started it now. All right, the minute is up. How are you feeling? Which vacation spot did you end up going to? Tell me about your experience.
I went to Cuba. I was on the beach. I felt the sun, cold drinks, people laughing around me, and spending the time with my family. I was wearing sandals and a loose top and shorts. I could also hear the waves from the beach. Everything was really bright and it made me happy.
That's a great choice for a vacation spot. The sound of the waves can be very calming and the bright colors can raise your mood. I'm glad this exercise was able to lift your mood. Shall we continue on to learning more self talk techniques?
Yes,
Perfect. Another technique is creating a self talk log, which is where you record your emotions as they happen. This can help you identify your emotions and the situations and thoughts that led to your emotions. You'll be able to reflect on yourself, and this will increase your overall self awareness.
this is a good idea too.
I'm glad you're supportive of these techniques. We can definitely add them to the homework at the end of the session.
Yes, I would like that. I really want to practice these techniques.
Great. Do you have any questions at all about any of the techniques so far?
No, they're pretty straightforward.
Yeah, they can be. We are getting close to the end of our session, so we can summarize what we learned today and the homework for this week. Is that okay with you?
Yes, that's good with me.
Great. So to summarize this session, our focus was your concern of not having a social life and the triggering situations, thoughts, feelings, and behaviors associated with this concern. We were able to identify the triggers, which were seeing employees make plans going out and not including you, when you're told about activities others did, and when you can't share the same experiences. We went over your thoughts in response to these situations which were thinking you're boring, annoying, or no one wants to spend time with you. We also went over your feelings and behaviors in response to these thoughts, which were isolating yourself, drinking, and feeling sad and alone. We then were able to identify that your thoughts have a big connection to your feelings and behaviors and introduced some self-talk techniques. Could you tell me about one self-talk technique you learned about today?
I learned about the technique where I change my negative thoughts to positive ones. I like that technique.
Exactly. We also went over thought stopping and breathing techniques like deep breathing and 4-7-8 breathing. Okay. I'd like you to try some of the other techniques we talked about today and get to try. The homework for this week is to keep a self-talk log where you record your emotions as they happen. I'll ask you to try at least 3 of these techniques we went over today to help you respond to your negative thoughts and reflect on how well they worked on a scale of 1 to 10. Lastly, I'll also encourage you to look into activities in your area that you'd be interested in joining and bring a list with you next time we meet, and we can go over them and possibly choose an activity for you to join as a next step to address your concerns of not having a social life. How does all this sound? Do you have any questions?
No, I don't. This sounds good to me so far.
Great. We'll recap next week. See you soon.
See you.